So we've come to the all-star portion of the meeting. Why don't you sit here and I'll just... Why don't you sit there, Deborah? No. I'll just use this. Okay. Do it that way. All right. You know, I was looking at all these chairs and I was getting very nervous as we approach this final part. So this is kind of the opportunity to engage, you know, everybody all at once. And I don't know about you, but listening to all the different case studies, as well as the opening speakers, you know, I certainly heard a lot of recurring themes. And I won't go into all of my reflections, but you know, just to say that one thing that I heard was how much this process is really a very human process of building community. And I'll say that as a former person in the ministry, in terms of talk about champions, building trust, engaging people. You know, and it struck me as even we're going through the overarching considerations around equity and leadership. And measurement and sustainability, you know, that if we actually color those words a little bit differently, we're talking about a moral dimension in terms of equity, and we're talking about a political dimension, small p, and as well as aspirational in terms of leadership, I believe. And all those, I think, core human competencies, I think, come into play as we approach this work. So I'd like to sort of bring the conversation back to those broad, overarching themes, if I may, because you've had an opportunity to engage each of the groups individually about their specific sites and their specific issues, but to maybe go back to those four overarching themes and see how people respond to that, if I may, and to sort of manage this so we're not all talking all at once. Maybe we'll just sort of limit the responses from both me and the audience and the folks on the web, you know, to maybe just 3 respondents at a time unless somebody has a burning desire to respond. Is that okay? At the same time, I'd like to get everybody to respond at least once, so I'll try to do that. So if I missed you, you know, sort of raise your hand frantically and I'll try to get to you. But one thing that, you know, I'll start with equity, because certainly in my experience, and I think listening to your experience, that this sometimes can be an issue difficult to bring up, you know, whether it's issues around race or issues around class or issues just simply around those folks who are marginalized in our community. It can often be a difficult one to bring up. So I was just sort of asking it, you know, as a response to all of you, you know, what are your recommendations for raising this issue, you know, in building a community collaborative?
When we think about equity, if we frame it, the words that we use matter. And so if we use words such as fairness, then you won't have anyone, I don't believe, who would be in disagreement that we all deserve to be treated fairly. When we start talking about issues of race and class, that's where I think people start to feel a little concerned. And there is a way that we can talk about race without calling someone racist. And so as long as we keep that in the back of our mind, how do we talk about issues of race that has impacted all of us? Without accusing someone, then you have less defensiveness. So I think it's all about our framing and our terminology and how we enter a conversation.
Anyone would like to respond to that?
Hello? You know, I think it's easier to maybe broach the topic about equity, especially when it's clear that it falls along income lines and neighborhood lines and racial ethnic lines. When we start out by saying that this is not about individual responsibility or individual behavior from the get-go. And that's what I tried to bring across by showing the roots back in the 1930s of neighborhood residential segregation, which then which drives in turn a lot of conditions that lead to certain behaviors. Some things don't have to do with behaviors at all. And so I think that's hard for, I'll speak from my practice as a public health practitioner. I think it's hard for leaders at the local, state, and federal levels to move away from an individual focus and towards a social determinants focus, those root causes. I think Michael Marmot has this phrase that he calls, we go into lifestyle drift. We drift back towards a lifestyle behavior change. And so that's one thought I have about it.
Anyone else want to get in on this? Helen?
Well, I would address it from the point of view of keeping the focus on children. Of course, that's my area. But when we talk about the children, it's a little easier for people to have some empathy for children, and to say that, to remind folks that every child is born with potential. Every child is deserving of an opportunity, and that we should set expectations high for every child. So then if we provide the resources and we provide the training that they need, then everyone benefits. I often talk about children as an investment. And of course, children as an investment bring an incredible return for all of society and for every person.
One thing, that struck me as I was listening to several of the case studies is that several groups mentioned that obesity actually wasn't the starting point. It came into the picture, and it maybe even ended up as being a central focus, but it wasn't necessarily kind of the starting point. But it was obviously something that was embedded in a larger thing. And what I heard instead was talk about population health, equity, community health, things like that. And I guess the question kind of occurred to me is what we're talking about, in fact, getting back to what Jim was talking about, that obesity is a symptom of where we're living, or is it the problem itself? And how do you see that in terms of building your own coalitions and engaging people on this issue?
I would say, in the beginning, in the case of Power Up in the St. Croix Valley, actually even using the word Children's Obesity Initiative was something that the committee, wasn't very interested in. They felt it was negative messaging. It didn't energize anyone to talk about doing obesity prevention. So interestingly, in our case, it was very open-ended. Let's do something to let all children in the valley have an opportunity to be healthy. That's what got people energized. That's what really was the kind of the catalyst around that. So obesity, sort of a byproduct of kids not being healthy, maybe not having access to food or open gyms or other programs, but no one wanted to focus on tackling childhood obesity, but rather promoting kids' health for all kids.
For me, it was, when the study came out that described 14 years difference in the life expectancy for my neighborhood versus the northern end of Cook County, and it talked specifically about obesity, chronic diseases, asthma, and heart disease, and all of them related to obesity. In my neighborhood, we have a lot of Superfunds and Brownsvilles where the factories have closed, but they left the poison. And so when I understood that all of these things work together to cause this short life expectancy, then, and of course, I have a granddaughter that is overweight, smart kid, spends most of her time in the computer, and the community is not that safe for her to go out as much as I did. I went outside when the sun came up, and I came back in when the street lights came on. Kids can't do that in my neighborhood today. So obesity became an issue for me as it related to the health of the young people around me.
Yeah, I think I heard from many of you as well that it wasn't about obesity, and that's certainly something we've been reflecting about our Heal Zone work, that we've been having internal conversations that say, you know, we wonder how many of our partners could really restate our 2 high-level healthy eating and our 2 high-level active living goals, and we think that it's highly unlikely that they could. And I think part of that is this whole notion about starting where the community is, starting where the needs are, whether that's, somebody was mentioning to me that it was about loose dogs getting in the way of folks being active in their community, or you know, safe neighborhoods or public safety. But I will tell you that through this process, folks come to see that it is about health and creating a healthy community. And it is music to my ears when I hear, you know, folks from the police department talking about why we need to eat healthy and have active lives and how that's related to public safety. Or a partner that really has nothing to do with public health talking about obesity. So I think if you start where the community is, the rest of it kind of follows.
I think what worked for educators, obviously we have a concern for children, that's our business, but our business isn't business per se, and so we took a business approach as far as the marketing. What is it that educators need to grab their attention, as I mentioned, and it had to do with the alignment for what was important to us, and I think that's the same as we listen to other sectors. What is transportation? What is their role? What can that be their role in this whole picture? So rather than taking the childhood obesity channel, we've taken it as a marketing. Here's what this can do for your business. At the same time, the result is what our goal is, which is changing the obesity trends.
Many of you, I mean, all of you talked about measurement in some form or fashion. And I'm just sort of curious what questions you might have had, even for each other, in like, why did they use that measurement as opposed to this? Or why are we talking about dose? What is Pamela talking about when we use that language? So I was just curious as to how you think about whether this conversation stirred any thoughts or questions in your minds about how we measure population health. How do we measure the progress in this cross-sector work? Want to start, Pam?
No, I don't. I'd rather take a question.
Well, so I saw a tweet about yours, and I didn't know whether the person, and I don't want to construe what I think this person is online, that he meant it critically, but he sort of talked about, we're going to medicalize the the process, and so because you were using kind of medical language in that, and I was just wondering if you've encountered any issues in sort of like talking to people that were trying to get you more doses in terms of evaluating this and that kind of thing.
So we've tried to change the language about 50 times, and it always comes back to this is just what resonates for people, even though they have issues with it, either that it's too medical or that it reminds them of the 70s. We've had that comment as well, different kind of dose, or the same kind of dose, different issue, non-medical. But it still rolls off people's tongue, and they get it, and they get the concept of reach a lot of people, touch a lot of lives with something that matters. And so that seems to work, even though we've had resistance. But really what I didn't get in the 15 minutes, I didn't really get to touch on, although I mentioned it, is just how hard it is to operationalize it at the community level. People get it completely, but there's so many barriers to building something that is more impactful in the time period that we fund. So it's a big problem to make it real, and then the measurement part is brand new. So having the measurement conversations with people is also, if we think operationalizing the concept is difficult, the measurement part is kind of over the top, actually. So we're talking in that way. We're talking about maybe we shouldn't even call it dose at all for how we demonstrate the impact using the concepts, because that is. It can actually come across as insulting if we say your work as it stands is not impactful enough for what you signed up for. That's kind of how it comes across. So we have to work on our messaging too. And at the end of the day, everybody wants the same thing, and that's an improved health of a community and more of a healthy environment. So that works, but how you measure it still doesn't. We struggle.
Okay.
Yeah, a couple of things came to my mind around the evaluation. It's something that at Nemours we are talking about all the time. We're 10 years into our work, so we're taking a deep breath and asking, how do we do this better? What does it look like tomorrow? So it sparked a lot of conversation and thinking in my mind. The main thoughts are one is, when we talked a lot about the evaluation today, it was about physical activity and a population health metric from that. But I do think we have to get to the point where we can bring all of those together so that we can have population health, not just the silos of active living, healthy eating. It's broader than that, so how do we bring it all together? So that's a question I have. It's also about building the capacity within our community partners and with our community partners and asking them to be at the table with us. I touched on it a little bit related to, we have to have the work that we put out be meaningful to all of us, not just to us or to our partners. It's got to be meaningful across the board. But there's a lot of capacity. I know in our state we hear over and over again, we need more funding, we need more resources, we don't understand how to do evaluation. And so that's a huge area to continue to learn and figure out.
Felipe, did you have some?
Yeah. I just wanted to bring up an observation. Kind of, I'm always asking questions. I love, measurement. It's a survey, and just doing evaluations is something I'm always interested in. But I always see that there's this. So in the sustainability community, oftentimes in the public health community, we don't want to talk about. So we talk about poor people. We talk about people with economic disadvantage, but we never talk about the labor conditions they're in and how to improve those conditions or even measure those conditions. So how do we expect to make these changes when that's actually a correlated effect? I mean, that's directly correlated. There's enough studies. I don't need to quote them. We can make that connection. I just find it interesting that we shy away from that conversation of, labor conditions, economic conditions. We can say these are poor communities, they're communities that are disadvantaged, but then we don't actually, look at that relationship and then find ways to elevate and uplift those communities. So I wanted to bring that point up just because I'm always interested in having that conversation. And oftentimes in the talks that I have, nobody really wants to talk about it. I don't know if it's too much or, that's a little bit too complicated. This feels a little bit safer to talk about maybe health equity from this perspective. We don't really want to touch on that because then we'd have to go into maybe politics and a couple other larger systemic changes, starting questioning maybe the system that we are in. Is the capitalistic model, is that the way to go? It does raise a lot of larger questions, but I do want to challenge everybody. I think it's good that we start having those conversations, especially in this kind of forums. So I'd love to see if anybody, maybe I'm wrong, maybe you are taking those measurements, you're looking at that from a different perspective, but not just to measure, but also how do we create the change now? What's the next step? Not just telling people what they already know.
So if I could follow up on that. So Cook County actually, you guys introduced a very interesting kind of angle onto an otherwise pretty pleasant conversation, a familiar conversation, unpleasant, about healthy eating and active living, to say, well, there's actually some deeper systemic issues here that involve, real injustice and real inequality, especially, for a whole class of workers. And at Kresege, we've even looked at farm worker conditions, that So I'm just kind of wondering, you know, getting back to some of the equity, the question for everybody else, have you found that in looking at some of the conditions in the community around health, that in fact there are economic or basic economic issues, underlying issues that you've encountered that you really have found difficult to tackle or have been, let's say, problematic for you or not? Just curious. Well, you guys are sort of looking at it, but I'm just kind of wondering because I'm just kind of wondering when people were even listening to you, how they were reacting to it. So, you know, was it like, what does that have to do with healthy communities? Or, you know, I'm just kind of curious as to how people responded to that. Because
you're asking how people responded to our message and our framing of this?
Well, I mean, it was, yeah, I mean, you introduced something that I think was a little bit new into the conversation. So I'm just kind of wondering how folks responded to that. Is that just, you know,
how the people who heard us back home responded? Yeah.
Oh, just your fellow panelists.
Oh, yeah, that's what I think he's asking. You're asking you guys.
Well, it could be the audience out there too as well. But just,
if I may, what we did in Sault Ste. Marie, and part of my Economic Development Commission's challenge is to bring manufacturing jobs to our community. Not only did they want manufacturing, the community wants manufacturing jobs, but they want high-paying manufacturing jobs, and then they want clean manufacturing jobs, and they want it, you know, 3 shifts. So it's a daunting task. This doesn't really answer the question, but here's what we've been very proud of. Manufacturing over the last 15 years has taken a nosedive nationally, but in the northern Michigan, I don't know whether it forgot about us or we hit under the radar, but it maintained a steady growth. And in a town of 14,000, we've got over 1,000 manufacturing jobs, which is fairly amazing. It's a long story how we got there, but our point is that we've got good paying jobs, and we've worked with the local university, Lake Superior State University, Go Lakers, we created this past year through Michigan Works and the Michigan Economic Development Commission a training program so kids out of high school can get, or it doesn't have to be kids even, we got some middle-aged folks as well, can get training, a 13-week class at our university, and when they get out of that class, there's jobs waiting for them at 15 to 20 bucks an hour plus benefits. And we're so proud of that, and matter of fact, we're already gearing up for next year to have more than 20 people attend this class. It's not easy. It's 2 nights a week for 13 weeks, and not everybody washes through it, but we're very proud of it. And we're making everything from fine surgical instruments to parts on your Jeep Grand Cherokee to, I could go on and on. Who would have thought in a little town like Sault Ste. Marie? So that's what we've done, and we've not taken no for an answer. When somebody's interested in coming to Sault Ste. Marie, we do our best, whether it's to build a building and they will come, or recognizing a building that's been vacant, purchase it and renovate it. It's been a combination of things, but it's been a very, very stable, supportive local community, both tribal and non-tribal.
So I didn't mean to exclude any questions from the audience, but so could you say who you are? And
Bob Griss with the Institute of Social Medicine and Community Health. The last couple of comments, I think, have helped clarify in my mind an issue that I was trying to understand in hearing all these inspiring examples of cooperation. It's so different from the way our society is functioning in general, and yet you're not talking explicitly about a counter social movement to take these functions that we often either leave to government or we leave to industry. And yet you're talking about processes that can be more responsive to human needs, whether it's called equity or social justice or just meeting human needs. And we've had, in some of the examples, healthcare companies actually investing in this process. Kaiser and HealthPartners and the ACA itself in creating, these community transformation grants. I haven't heard any talk, however, about the potential of this process for transforming our healthcare delivery system that responds to all of these symptoms of inequality. And I'm wondering if you're deliberately not talking about that because it's not polite or because it's not interesting. But to me, it's the most interesting issue. If you're really finding effective ways of reducing the symptoms of inequality and poverty, this is clearly going to have implications for the kind of healthcare system we need.
How do we move from like demonstration to really movement, changing a whole movement towards better equity and health?
Well, that's what I think the panel should be addressing more explicitly.
Why don't I ask our federal representatives to, Melissa, we haven't heard from you actually, so you want to, or Susan, you want to take a crack at that?
I think the lesson I learned on that is I was just in my DC office and I feel very passionate about being on the council, and that the comment about top down versus bottoms up, and at first through my educational process, I kept thinking, oh, I'm just doing projects and I'm just doing programs, and I'm not headed in the right direction because I'm not doing policy and really implementation. And yet, I think all of it has a role, but I really think it happens in the communities. And we've all touched on it. It's the collaboration, it's the concept of partnerships. I mean, it's really about who you know and the fact that you are trusted and that I can open doors, and no matter what my senior leadership in DC is saying, what they're saying is we're a federal agency and we've got to cut our budget and we've got to cut our staff, and because we don't have the money, we can't do another thing. And I walked out of there and I thought, I was discouraged, and I thought, what I really think is just keep doing what I'm doing and don't ask for permission. And I've got enough partners in my own community that I really think that if the mission is right, people know their kids are in trouble, and they know it at all different levels. And if you can get a roundtable, again and again, as I was doing this work, I kept visiting each different kind of area of interest, whether it's a foundation, whether it's a governor's office, whether it's a congressional office, whether it's a healthcare provider. And I realized no one is talking to each other, and I'm the only one talking to all of them about the council. They don't even know the council exists in most of the cases. So I did a wind project in Colorado in 2000, and I was working for the same federal agency, and the utility was going to supply wind, and my partner across the street was with the Department of Energy, and he called me up and he said, Sue, you're all the buildings in 6 states and I'm wind energy, why don't we work together? And we sold the largest amount of wind in the history of the United States in 2000 for Earth Day. And Secretary Richardson from the Department of Energy came out to help us celebrate, and he's on the stage and he does this to me and he goes, so how'd you do this? And I said, well, we never called you in DC. And it was just exactly, so you do have people of passion in your communities. People know what the problems are. Don't ask for permission, go find them, and then find out what you want to work on and make it reasonable and measurable and achievable, and then just build from there.
Marna, you want to? I mean, it sounds like you're creating a movement in St. Croix Valley. I mean, so.
Yeah, I've been reflecting a lot on all the different factors that that I've heard so many people talk about, and I think that authenticity of having the community be at the table is obviously at the core. And in addition, I do think welcoming the entire community in is also really important, and that's why we have put a focus on the communication strategy. You know, we're not going to get 100% of the community to sit down with us one-on-one or engage in a committee or volunteer, and so how the rest of the community experiences this is really important. And so I think having a really positive and inclusive and non-judgmental and we have a bunch of communication rules, no should, no healthy, et cetera, and it's difficult to do for health people to communicate in a more inclusive way. You know, you asked about obesity earlier, and that's another reason that isn't in the communications strategy. Mostly it's not in the foundation of the work, but again, is that going to bring people in and, hey, I want to join that with my family, or I want to get involved? So I think just careful thinking about that has really helped light a fire that people may learn about what's going on in the community through lots of channels. And we have a pediatric dentist that joined our work about a year ago, and it's the first time I've heard the answer. I said, well, where did you learn about it? She said, from a billboard. You know, her office is not that far from our hospital. I said, really? The marketing people had been telling me we needed to do billboards. I'm like, really? So anyway, there she is, and she's been a great contributor. So I do think having a message that has some thought behind it, as well as all these other pieces, has really lended energy to the work.
I also want to add, I think that when you build it on something successful, Denver at one point thought that they were going to win the Super Bowl, and Seattle was the only group that disagreed with us on that. And what it was is everybody wants to be part of a success. And when you are building from the sense that this is fun, as Sue Hedlund talked about, and you're going to be a partner in that success, you're going to have a whole lot more opportunity to get people to join you.
Yeah, well, I think our time is almost up, but I was going to ask any member of the roundtable if you had a specific question for our panelist here. Otherwise, Bill?
Bill Purcell from the roundtable. Let me ask you another kind of sustainability question. Do you think about who will take your place in this work? Do you have a succession plan? And how important do you think that is? Now, let me say, on behalf of the Institute of Medicine, you all look very healthy to me, and I'm not at all concerned. But 15 or 20 years from now, or if something else should change, how do you sustain that part of the work?
I think it's really critical that we create succession plans. I think that, I know that within our organization, we've got a lot of really young, bright, eager, enthusiastic young people, and I try to engage them as much as possible. I think that it's really important for us to really groom the next generation, even when we're not thinking about it's time for us to personally retire. But I think that we've got a responsibility to share and not hold on to our knowledge and our experiences, and not hold on to our perception of power. That we really, part of the responsibility I believe that we have in this role is to share that learning and to broaden the arena. So I totally agree with you. I think there are very few organizations do deliberate, intentional succession planning, and I think it's a mistake.
I really want to respond to that as well. The things I'm doing today, people, let me tell you, it's my bucket list stuff. You know, I know that I can't do this forever. And I was at my national meeting about 2 years ago, and it was time for me to run for school board again. And I'm sitting at a table with people like yourselves, this one guy, a researcher, PhD, and I had called him out in a meeting. I remembered it so well because I didn't mean to. And he had talked about some research that didn't include some of the factors that cause people to draw the wrong conclusions about black people. And so I raised my hand and I asked him the question, and then a lot of people got into it. Well, I'm sitting at a table with him a couple of years later, and I'm lamenting, and I'm like, but what I noticed, he was talking to the people at my table, 2 elderly women, and he said, you know, I grew up in the town where you're on the school board. I will come there free, volunteer, and help you organize. And I'm like, wow, has he changed? And then I'm lamenting, and I'm like, it's time to run. I don't think I'm going to run this time. I just can't do it. And he says, you can't leave until you create 10 people to take your place. I want you to know I am busy working on that right now. And I want to thank the Place Matters national team, because at our meeting back in May, they presented Youth in Nature program. And they talked about 5 fellows that were going to be a part of this training of young people. And we were able to get a young woman from Cook County to go. She's a college student, her last year, and she went for the training. It was wonderful for her. And now she's planning family nature activities in our community. One of the projects she's working on right now is a field trip to the zoo on the northern end of our county. Well, that just seemed something simple, but on the way to that field trip to this beautiful Brookfield Zoo that we have, she's going through the forest preserve that's owned by our Cook County to get there with this busload of family members. And there's debris, there is just all types of just lack of care, and she'll be talking to those family members about that. And then she'll show them what's happening on the northern end with the tax dollars that our county, Jim, is spending, you know. And so she's becoming more aware, and she's making more family members aware, and hopefully this young lady and 9 more people will allow me to really retire.
Okay. With that, I think our time is up. So sorry, Ted. But I do want to say thank you and ask our audience on the web from the hand. And I'm turning the program over now back to our chairperson, Nico Pronk.